Okay, so Deanna just finished, well, today's her last visit, and we did our evaluation. And I'm totally blown away at how well she's done. I know she's done really well. So tell a little bit about what brought you into the office. What was this? What were your symptoms first?
Well, I do a lot of walking and for exercise as well as doing my gym thing. And my feet would just keep burning and burning all the time. It was just achy and really not able to really function really well and feel good about it.
And how long had that been bothering you for?
Oh gosh, it's probably been 15 years.
Okay. Now,
So-
Deanna came in and actually did another program of mine a few years ago for thyroid problems, and she did really well with that as well. She came in a couple months ago and said, hey, I saw your ad and I have this, and I didn't even know she was dealing with that. So we put together a program for her. And so when she started out, she was 73% loss of function on her one foot and 63% loss of function on the other. Today, we just did the reeval, and what were your numbers?
8 on one side and 21 on the other side.
8% loss. She went from 63% loss of function to 8% loss, which is incredible. I've never had that happen so far. So that's the best results I've ever seen so far. The other one, to go to 21%, is incredible as well. When you start out at 73% loss of function and go to 21%, that's incredible. You know, I'm happy when I see a 55% functionality versus when you're that low. So that was incredible. I'm kind of speechless. It's incredible how well she's done. Now, why did you think you've done so well? Because you were just telling me that. So tell the audience, whoever's watching this, why did you do so well?
I think I did well because I was really strict with the diet,
Okay.
which also let me lose 18 pounds.
Wow. We'll take that. Yeah. And how old are you?
So I'm 77.
77. So usually 77-year-old people aren't losing weight unless there's problems like health problems, right?
Yes.
So that's great. I mean, so an added bonus. But she stuck to the diet. She did the metabolic stuff that we needed to do. And look at those numbers. 21% loss of function and 8% loss of function. So that means her numbers basically flipped. On her one foot, she had a 73% loss, and now she has 73% gain, which is awesome. What would you recommend people who are looking at this program?
I would say come in, talk to Dr. Watt, and just adhere to whatever he says and be strict about everything.
Because it's worth it. I mean, it's so much worth it to avoid the bad stuff to get what we've gotten.
Yeah. And sometimes it's just really hard to follow a diet day after day.
Right?
After
Yeah,
day.
it gets old for sure.
And you just got to really be strict and keep
stick
your
to it. Yeah.
mind in the right place and
Look at the
it
big
works.
picture. Yeah, for sure. Now, do you have any more burning in the feet? I didn't even ask you
No.
this question. No more burning in the feet. You're walking, you're exercising, and all that stuff. She goes to curves regularly, and no more pain.
Right.
That's a high five right there. Thank you so much. You've been awesome.